If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? It's your man, Dr. Kyle. Welcome back to the Driven Athlete Podcast. We got Dr. Nelli Gluzman with us. She is a local pediatrician and really diving into like functional medicine for kids, which is super interesting because like there's a lot of that for adults, but I mean, I haven't heard of that for kids, you know, like this kind of integrative approach. So thanks for coming in. I know you're busy. So thanks for coming in.
Thank you so much for having me on.
Share about where you're where your practice is at, where you're located, and like what kind of clientele you see.
Yeah, I'd love to. My practice is Blossom Pediatrics. It's it was primarily based in the tri-state in New York, expanded into New Jersey. And with my move to South Florida, I expanded into the Miami area, now expanding into the Palm Beaches where I live now.
Yeah, awesome. Mm-hmm. When did you move here?
The practice I opened like a year ago. I already knew I was moving, and just a couple of months ago. It feels like forever. I feel like I've been here forever.
I mean,
yeah,
you're really easy to like get along with, so. I'm sure you've integrated well.
Like 60 degrees was already freezing for me, so.
Yeah, I mean, it was chilly this past week.
Yeah.
I mean, like we were all like, you know, getting our sweaters out and stuff.
I did it too, which means I'm a local now.
Yeah,
so.
I mean, but it's also like, I feel like, you know, low 60s here feels a lot colder than low 60s up north because of the humidity. I mean, it's like dense, you know, it's chilly. But anyway, yeah, I'm definitely Florida, you know, Florida blood for sure. So Blossom Pediatrics is what it's called.
Yes.
And what do you specialize? Like, what's like your clientele base?
Yeah. So it's the language that we use is an interesting issue because out in the world, most parents don't know what functional medicine is. They might know what integrative medicine is. Even that is not a common way to explain what we're doing, what we're trying to do, or the goal, or how it differs from a conventional way of practicing. Yeah. Some parents might call it a holistic approach, and that could also be a word that's very triggering for others. So it's a mouthful, but I call it an integrative, functional, and holistic practice. And really, it's very simple. It's looking to reverse chronic illness in kids by treating the root cause and not just treating the symptoms or the trigger.
Gotcha. And I want to dive into like what that stuff means. What led you to go to med school in the first place?
I was obsessed with the show ER.
Oh, okay.
And I also at this, so that led me to like working always at high school and all through college, like full time as the front desk of all these different medical practices. And I was just obsessed with the medicine behind it. And then the physicians that were so kind that I worked with took me under their wing. And then they started to let me do things like vital signs. And I just became absolutely obsessed. And I switched my major from, I was studying applied mathematics. I did finish with that degree.
Wow.
And then I also did pre-med.
Wow. So the dual major.
Essentially, yes.
Applied mathematics, that sounds like the worst for me.
That was super fun.
That's fun. That's really fun. I like algebra and math. I just get really excited. That's funny. That's not me. Where'd you go to school? Where'd you go to undergrad?
Undergrad was in Manhattan, Pace University. My first day of school was when 9/11 happened, actually, like right down the street.
Oh my gosh.
So it was, the college experience was really shifted for me as a New Yorker.
Yeah. What did you do? I mean, that was your first day of school. I assume you went home and like
I didn't even know which direction to go to class, like to go to school. And it was yeah, I mean, then, so like half the year was gone the first year. But very quickly the community in my university, Pace University, really rallied together, and the mental health impacts were addressed so well. I really applaud them because this was at a time that it wasn't a popular way to approach like teen or older or young adult traumatic events. Looking back now, I really applaud them for a job well done and the services that they provided everyone.
Amazing. I mean, I feel like the mental health component of that is relatively new, like a new thought and approach.
Yeah, it is. It really is.
Wow. Well, that's crazy. All right. So shifting gears, you went to Manhattan Pace University
Yes.
for undergrad. And then where'd you go to medical school?
Then I did 1 year of clinical research in sleep. I was a data analyst with my math degree in a sleep study. So I was doing clinical trials, so very like scientific, in a sleep lab in Manhattan, and then I went to New York College of Osteopathic Medicine, which is in Long Island, also New York.
Oh, okay, cool, awesome. So you're born and raised in like Manhattan, New York area?
I was born in Ukraine, but I grew up in New York.
Oh, okay, cool.
Yeah, and I'm losing the language big time.
I mean, I know, like, I mean, if you're immersed in it, you know, like, cause I went to the University of Miami, right? So like I learned a little bit of Spanish there and I was like immersed in, I was getting somewhat good, you know, with like clinical terms and stuff. And then as soon as I left, like a lot of it's, you know, fading away. Wow. Okay. So from Ukraine originally, moved here. How old were you when you moved to?
6.
You were 6. Okay. Do you remember much of Ukraine?
I do. Yeah. I absolutely do.
Okay, cool. That's awesome. All right. So you went to DO school, medical school. What made you want to go to pediatrics then?
I didn't know if I wanted to go into pediatrics, or I really had no clue. I was completely wide open to all the fields. But when in medical school, it's 4 years, but the first and second year are all like in a classroom mostly. And the third and fourth year are in the US are rotations. So you get to see as a student what it's like to be a surgeon, what it's like to go through all the main like specialties, and then you get to decide what you're interested in pursuing for your residency. And so I just never felt enough empathy for like adults to be able to treat them the way that I needed to treat them to be their physician. I was kind of like, you're an adult, so you did this to yourself. So
like take care of yourself. You know, it's the problem here.
A lot of it is preventative medicine, and not everything, but so it had to be pediatrics because I never met a parent that I didn't resonate with, even not being a parent. That's another thing is a lot of times folks who decide to go into adult medicine, they're like, I just can't deal with the parents. They're so stressed out. But I actually really do understand where they're coming from, and it makes perfect sense to me. So I'm with them like every step of the way, energetically, emotionally. It was always very easy for me to understand why they're so stressed out, why they might be in a place where they are when it comes to their kids' health. I wasn't a parent then, but now I understand even more.
Yeah, totally. And how many kids do you have?
I have one 13-year-old.
13-year-old. And she's at Benjamin?
Oxbridge.
Oxbridge, that's right. Oxbridge, yeah. Because we've seen her a couple times in the clinic.
Yeah.
She's doing her homework. You know?
Yes, good.
She seems very studious.
Good.
I got 3 kids, you know, too. Mine are younger. My daughter's 5, my son's 3, and my youngest son's 11 months. But it's crazy, like different perspective shift, you know, when you have kids. I feel like my drive home from the hospital after my first kid was born, my daughter, different. Even then, like the drive home, I was careful. I was like, it's just different mindset and different perspective. But I'm sure parents can be, there's like a lot of emotions involved.
A lot of emotions involved, yeah. And absolutely. I mean, what could be more daunting to a parent than a child who's not well? There's nothing.
Totally. So what are some of the most, like, what are the most common things that you see patients, like your pediatric patients?
Well, before I decided to switch the way that I practice into this very uncommon approach, I was a pediatric hospitalist for like 13 years.
Oh, wow.
So my specialty was hospital medicine. So if a child is admitted to a hospital and cannot go home because they're so sick, that was my specialty. And I taught in the field, and that's what I did day in and day out. And I really was a hospitalist, and I thought I was so good at what I did. When my own daughter, who was about 3 or 4 at the time. She started getting sick all the time, and not like regular viruses that all kids get, but hers would linger, and she would get eczema and asthma and allergies and wheezing. And like 1 year, she was on like 7 courses of antibiotics,
My
and
God.
she couldn't breathe. She was just always congested. She wasn't thriving. She just looked so sickly. And I went to all the specialists, and I had access to all the best doctors, but we were able to treat the problem each time, but never really reverse her from getting into this spiral and loop and over and over and over and over again. Like this, in 1 year, I think she missed more days of school being sick than in school, like pre-K, pre-K3. So I quickly realized that this is just what I know is not enough. Yes, life-saving medicine is what I know.
Yeah.
I could get a really sick kid home to their parents. I can go to deliveries and resuscitate, and I could go to the ER, and I was really good at that. But I really quickly realized that there was just none of the fields that were able to address the acute issue and get her from not getting pneumonia, but with antibiotics, or not getting sepsis and being able to breathe and stopping her rashes, but really preventing it from happening. And that's why I had to, for my own kid, try to figure out what was going on. And it was surprisingly difficult.
Interesting. My roommate in college is a pediatric hospitalist. He's in Tampa right now, from my understanding, but he went to USF. But I was asking him like his position as a hospitalist. And so, I mean, it's heavy, you know, he's like just helping kids not die, you know, and then get them home as best as possible. What made you shift from that to what you're doing? Like, what was the moment? Was it your own daughter's experience?
Yeah, my daughter's experience. So when I finally, it was so simple, and I finally found that one pediatrician in all of the tri-state area, like New York, New Jersey, Connecticut, that was a more of a holistically root cause oriented doctor to go to. The wait was forever, like a half a year I waited to see him.
Really?
Brought her in. He gave me just like a few simple steps. Like, I don't want to, you know, I could say what there was some nutritional changes, take out some things that are not serving her. It's personalized. It was specific to what he believed she needed. But essentially the format was take the things out that are not helping her: inflammation, immune system. Put the things in that will give her the building blocks needed to heal. I'm paraphrasing what he actually explained. And then using some very specific supplements in a key way to restore health, not to rely on them forever, but really to restore health long-term. And within a couple of months, she was a completely different child.
Really?
I was so surprised. At first I was like, this cannot possibly be so simple, but what can I do? I mean, we waited this long.
Yeah.
I have no other choice. It can't be this simple. And it really was. And she has never went back to being a sick kid again. She was thriving. She was happy. And so this is when I knew that it's not okay for, even as a pediatrician with all the resources and knowledge, to only have access to this one physician in all of the tri-state. He's no longer practicing. That's just not okay for me. Like my eyes, I could never go back to just that. So relearning everything took time, and I opened my practice.
Interesting. Well, it's amazing. If you don't mind sharing, like what was, so I imagine a lot of the patients you see now, the kids, had a similar issue your daughter did.
Yeah.
Which it sounds like a lot of gut biome, metabolic breakdown that causes like inflammation responses. Is that accurate?
Yeah.
So yeah, what was going on?
With my, you know, it's multifactorial. It's not ever one thing. Okay. In the conventional medicine realm. So conventional medicine, when I say that, I mean like your regular pediatricians whose job is so important to make sure that all of the anticipatory guidance is done, to make sure that they're developing properly, they're growing, they're getting their basic eye checks. Those annual exams are absolutely essential. Baseline must happen. That's like first line of a defense. If a specialist is needed because there's something that keeps happening or we don't know what's happening, you have to go. You have to go to your allergist to find out what the allergy is. You have to go to your dermatologist, just get a right diagnosis. You have to go to your pulmonologist if there's constant chronic wheeze or respiratory issues. Psychiatrist. Those fields treat the symptom of the problem very well. They could also identify what is triggering the issues so well. But if your child is relying on all of these visits over and over and put on medications that stop the symptoms for not just a short period of time and then it goes away and it's not a problem anymore, but for months and years, but they're only 3, 4, 5 years old, babies who are on steroids for most of their life because their eczema is just flaring and flaring.
Yeah.
Kids who are not digesting their food, they're not growing, they're not thriving, they're always constipated and needing to be on laxatives to stool for months at a time. And this is so common. Then you have to look outside of that approach to address the root cause. And conventional medicine doesn't really have the methodologies or the approach. Like, it's a different field. It's a completely different field to reverse the root cause and not. And so I completely deviated from the question, but it's multifactorial. Like, why does my kid keep having whatever problem? That's not normal. Just because everyone in the classroom has a food allergy, that's not normal. Just because everyone has seasonal allergies, that doesn't make it normal. It just means that there's a lot of issue going on with many people. And so it's multifactorial. There's many different factors. There's always a genetic factor. Those fields will say there's a genetic predisposition. Yes, absolutely.
I know. I don't like that. I mean, yes.
Yes, but
like
everything's genetic.
I know.
Of course.
What's making it express that?
Right. I feel that in my practice right now, yes, there's environmental factors. Yes, there's a lot of toxins out there. Sure, there's so many stressors that our kids are undergoing. Yes, our food supply could be much improved. But I feel like the most root cause issue is a breakdown of gut health in general. And that could look like different things for different kids and probably adults as well. But we're seeing it with kids in such a massive way. It's not all bad news, by the way, because this is not hard to fix, especially in kids. It's not. You have to just, it's a few small changes can make the biggest impact to reverse chronic problems in kids.
Amazing. Well, good. So what does that look like? Like, well, what does that come about? And like, what does that look like? And then, what changes do you make? It's
always customized. Like, there's never the same approach for 2 different families, 2 different kids. Why? What we're seeing, let's say, the rise in eczema, asthma, allergies right now, skyrocketing. I mean, when I first meet families and I ask them, what medication is your child on? Most of the time, and I for the families listening right now, I'm going to ask you, what medication is your child on? And you'll list them off. And then if you forget the allergy medicine, that's a red flag because you're already putting that in the bucket of this is normal. Like the Zyrtec, Claritin, Flonase medications that kids are on. What medication is your child on? If you forget the EpiPen that they have to walk around with because they could have an anaphylactic reaction any minute, even if you never used it, that's a chronic problem. If you forget the albuterol or the preventative inhalers that your kids have to be on, the inhaled steroids, if you forget the steroid creams that you're always using, even the over-the-counter hydrocortisone, if you're using them all the time to make sure that there's no eczema popping up or rashes all the time, that's a chronic problem. And so the fact that families are forgetting that these are chronic medications to suppress inflammation, and they do a very good job and they're very important to use short term, there's a chronic issue. And most of the improvement in reversing these issues and the prevention of them getting worse, like worse allergies, worse anaphylaxis, later on could develop into autoimmune illnesses of all sorts, behavioral issues, it all really stems from gut health, optimizing that. And it varies, the exact details. And I'll go over like the basics, like what do you need to do right now in home listening if you feel like this is your child. There are steps that you can take without seeing somebody like me to get going that will make a massive impact on your whole family's health. But it's gut health. It's when the gut lining starts to break down and the microbiome can't support it. And then you have a cascade of issues, gut permeability, toxins, large molecules get into the bloodstream, mounting a very appropriate immune response. This is not usually looking like constipation or abdominal pain or bloating. Sometimes it does. And then we're seeing this so much more now. And this is something that is easy to test. We have all the data, we have all the science that the microbes that protect the gut lining and make it healthy and make it not so leaky, is a common term, are from generation to generation of antibiotic use, not restoring healthy microbiomes, the way that we're eating, multiple generations of like C-sections, all of that is impacting our kids in a massive way. And it's manifest as these inflammatory illnesses in kids.
And the common ones for that, the inflammatory illnesses, eczema, asthma, and allergies.
No, it's all the digestive issues that are chronic. It's the behavioral issues. It's the developmental problems, autoimmune illness. It all, the most root, if you're really looking at the root cause of everything, it's usually gut health. But what exactly is going on with the gut varies in so many kids.
Interesting. So the thought would be like the gut is so influential because what you consume consistently just sets the stage for things to be not broken down well. Inflammatory responses, those consistent inflammatory or lack of breakdown in the gut sends things in your bloodstream.
That's one route. Yeah.
That then causes a lot of these genetic issues to be expressed and then cause issues down the road.
Yes. Yes, that's one route. That's like one thing that could go wrong. Okay. Or you could have so if there's not enough this is like a simple way of saying it. If there's not enough beneficial microbes in the gut to protect the microbes that are okay to have in very small amounts that are inflammatory, they'll overtake the system. This is why when a child takes antibiotics, you can have an imbalance, dysbiosis. This is why when an adult takes antibiotics, that can cause some imbalances in the system, like thrush or yeast infections for adults. Not as common in kids, but antibiotics are life-saving medicine. I will absolutely prescribe them when they're needed, but remediation has to happen afterwards to make sure that we bring in those healthy microbes in a very specific way to restore health to the gut lining, to the microbiome. Very often and this is all testable. There's companies that do absolutely fantastic job in the pediatric setting in letting us know exactly what the problem is. So it's not some of it is a guessing game, like what do we eat while we wait for the results? And some of it is these specific probiotics, these specific supplements for a short period of time to do what they're supposed to do so that their balance is restored in the healthy microbes versus the pathogenic or harmful inflammatory ones.
Yeah. Gotcha. So what do they present? Like what are really common, what does that look like? Like commonly, like what's like a common, cause it's like one route you said was what I described. The other routes you're describing, like what's a really common case that you look at? And then what do you do?
Okay. So I kind of like the bigger issues. The gut is in my practice, the first brain. So anytime there's a child with neurodevelopmental issues, we have to look at gut health first.
And that'd be like cognitive delay.
Gross motor, fine motor delays, speech delays. It could be psychiatric issues. It could be ADD and ADHD.
I feel like that's so really overly diagnosed, in my opinion. I don't know, but not my specialty.
Hard to say, for many reasons.
I guess what I mean is like
podcast that I could talk for hours about that. But if you need to address like that, so much of optimizing sleep, making sure that the child is able to be resilient enough to get the most from their therapies, any behavioral issues, So much can be improved by optimizing gut health, and it's so simple to do. So that's like one approach in my practice that I tend to lean on as the most foundational step, because I see so many kids having that as an issue. But there's other things that could also be optimized. I look at precision medicine, genomics, usually not first line, because so much improvement can happen with these, just optimizing gut health. Optimizing gut health, meaning like give the child the building blocks that they need to heal the gut lining. Another one, chronic ear infections, where a child is starting to have maybe they need their adenoids removed, tonsils removed. Maybe they need to be on Flonase to stop the inflammation. Maybe they're mouth breathers chronically. Maybe they're getting sick all the time. Have they been on multiple courses of antibiotics for ear infections already? All of those are red flags that the microbiome is imbalanced. And there's a microbiome in the ear, nose, and throat system as well that differs a bit from the microbiome of the gut, but that can be optimized too.
Interesting. So let's say somebody comes in with neurodevelopmental issues, and you're suspecting with the lens that the microbiome has affected the gut. What are the simple changes?
Not just neurodevelopmental changes, but really anything chronic. If simple changes, take the things out of your child's system, body, life that are absolutely not good for them. Like, they're not good for them.
Candy.
I'll let you parents decide for yourselves.
Okay.
I'm happy to help. Most
Processed food.
Most people listening to your podcast have an idea of what that might be.
Yeah.
Maybe doing an honest inventory. But the key here is not stressing anyone out. Okay. I could in adult medicine, you've seen them all the protocols for this, that, autoimmune, biohack, whatever. That doesn't work with kids and families. That's not how life works. It has to be something that is not going to stress them out. Stress is a common trigger. And if you have a kid who's used to eating with their friends in school and everything, but they're already sick all the time, they're already under stress. They maybe already have food aversions. Maybe they're not growing or thriving. You can't just take all the things out like this and say, good luck. Or I will never sit there and go, here's the perfect protocol for your child. This is what they should not eat. This is what they should eat. It's never going to work. It has to be small changes over time that will not stress out mom, dad, siblings, the dog, and especially the child. The
kid themselves, yeah.
Yeah, it's surprising at how small changes make such a big impact. Like, even if you just leave them alone at school because they're eating their stuff at school and there's birthday parties, I would never say, like, don't celebrate your stuff unless there's really... I rarely say that. Like, there's holidays, weekends, birthdays. That mental health component is so important. Like, but if you're all eating together as family, let's make some small changes anyway, and for the whole household. Yeah. Usually everyone benefits from these. We know. We know refined sugars are not good for kids in large amounts, especially. We know that dyes are not great for colorings, chemicals, foods that are not foods. We know all this. Yeah. But even more importantly than what are we taking out is what are we giving them to, what are those building blocks? What does the gut lining need to heal? Because the gut lining is where we absorb nutrients, and where kids especially absorb nutrients and detox. This is where neurotransmitters are made. It's the first brain. Most physicians understand this at this point, that if you want to heal any neurological, behavioral, psychiatric issues in kids, the gut is connected. So it's the first brain. Start there. So what do we add to that gut lining? Simple. I tend to lean on nutrition dramatically, because it's more helpful than any supplements, honestly. Like, some key things that I tend to very often add into my protocols for the families that I treat and my patients, the kids, is bone broth and lactofermented fruits or vegetables. Don't get overwhelmed. It's very simple. Bone broths are the amino acids and collagens that the gut lining needs to repair itself. That gut lining is one cell layer thick. It's called the endothelial lining. It needs building blocks to heal. bone broth. This is traditional wisdom. I didn't make this up. It's been around forever. Most traditional cultures have a version of this. You can make bone broth yourself in 5 minutes. It really takes 5 minutes with a slow cooker. Quality bones matter. It could be chicken. It could be beef. I could go do a whole episode on this. Look up bone broth recipe, slow cook, make sure it's quality. If you're saying, wait, my kid is not going to drink bone broth, that's totally fine. Most won't. Add it to the foods that you're eating that are not being drained of their liquids. There you go. So add them to the rice, the quinoa, the soups. It's soup season now that we're recording, at least in the Northeast.
Yeah, soup season.
Yeah.
It's like soup week when it's like cold here, you know, and then the next another week.
Yeah. So bone broth, I feel like most families can add into their kids' system. There are very few that have histamine sensitivities that I would tread lightly with. Talk to your doctor if you're not sure, although most conventional medicine doctors don't really think about histamine. Okay, usually those are the kids with like multiple allergies or in the middle of allergy season that might be sensitive to the histamine that is naturally found. And histamine is not our foe. It's just a normal part of life and in certain foods. And then the second addition is it's a wordy one. It's not scary. It could be done easily. I promise you. It's lactofermented fruits or vegetables. So we think about sauerkraut, kimchi. I know your kid won't eat it. Don't worry about that. There's very kid-friendly ferments out there. You don't need to make it yourself. You can. I'll teach you if you want. You could buy it, very high-quality brands. You just need like a tablespoon a day. Why? Most probiotics that most people will agree might be helpful. They are super expensive sometimes. They're great sometimes. They're measured in colony-forming units, and they're typically in the billions as like the most high-quality ones. And I use probiotics in my practice all the time for specific strains that are not available through foods. So most supplements, probiotics, are in the billions range that are high quality. A tablespoon of a high-quality lacto-fermented fruit or vegetable. So any fruit or vegetable can be fermented naturally to be a probiotic powerhouse naturally. So all you're adding is salt to the mix, and it's an anaerobic process I'm going to get a little sciencey. Basically, you just need the vegetables are either, let's say it's cabbage, very common one. Cabbage, water from the cabbage, which is, it's the brine, so that's released when you add salt to it from the actual cabbage. And then you suspend it in its brine, which is that liquid salt, liquid solution. And then it sits there. And so all of the microbes that will rot the cabbage will die. And the natural microbes that are essential to human health in these vegetables and fruits will thrive under that water line.
Cool.
And so one tablespoon of a high quality lacto fermented fruit or vegetable is about 1.5 trillion beneficial and alive microbes that are so much more bioavailable, because when you ferment a vegetable, you're pre-digesting it, so it's a lot easier to digest. You just need a tablespoon a day. You could mix it into anything that's not too hot. And a lot of companies are now making really fun ones, like fermented carrot sticks, fermented cucumbers. Don't convince these with pickles. Pickles are in vinegar, and they're not a probiotic powerhouse that will create a diversity of healthy microbes in a gut. These are the two things that I really tend to lean on a lot. So there's brands that make really kid-friendly ones, like fermented applesauce, pear sauce. Just doesn't have to be hard or gross. You don't have to convince your kids to eat it. Fermented lemonades.
Cool.
Whole Foods sells them. You just have to know where to look and what the quality is.
So the probiotic powerhouse and bone broth are two common things that you find yourself suggesting to patients for different things.
Yes.
Interesting. It's getting personal. One of my kids salivates a lot, and he's 3, and then he is a mouth breather.
Mm-hmm.
And he's a little bit more food, just like picky, or like, I don't want to eat right now or whatever. And then what times we'll crush food, But anyways, it's interesting you mentioned that because we are going to get some consult on that. We were told to go see an ENT first.
I agree. But why? Because you have to know where the problem is coming from, if it's anatomical, and how severe is it. If the adenoids are really enlarged, if there's anatomical obstruction happening, causing the mouth breathing. And I'm so glad that you're going, because a proper breathing in somebody your child's age is absolutely essential to neurodevelopment.
Yeah.
And so, yes, ENTs will be able to check with X-ray or scope to see where the problem is.
Yeah.
And then they might offer solutions that calm the inflammation. It could be a surgical approach. It varies. It depends on what the problem is and how severe it is. Very often they'll prescribe nasal steroids to calm the inflammation. They'll work. But if this keeps happening, sometimes surgery is the way to go, but you could also add things into the system that will help inflammation of, let's say it's adenoids, it's common, calm down naturally. Like there's probiotics that are very specific to the ear, nose, and throat system that will help combat some of the inflammation. I love xylitol nasal spray. I think it's really a very underutilized modality that is available for everyone. And because I'm always thinking about what building blocks does a child's body need to combat this inflammation, to give it more resiliency.
Yeah.
And so it has to start with, what environment are the nasal passages in? Xylitol nasal sprays, like one company that I really like, this is like not a promo or anything, it's called XLEAR, like X-Clear, basically.
Okay.
Xylitol is going to feed the beneficial microbes in the nasal passages. And it doesn't have chemicals that a lot of nasal sprays have as preservatives that could actually dry out things in the long run. So this is like a nice, easy approach. I can't say it's going to fix everything, but sometimes when you take all of these preventative measures together, you might be able to avoid surgery, adenoid removal, needing antibiotics, needing to rely on nasal sprays for a long time. Another essential component that an ENT might check is, are there allergies causing all that inflammation?
Yeah.
And so if there are, then again, it would be the same thing, a nasal spray or something like over-the-counter allergy medicine to stop that histamine response temporarily. And these things are always going to work. They work short-term. They block the histamine connectors. Like if you've moms and dads listening out there, or anyone listening right now, you know that if you've ever had seasonal allergies, that's runny nose, runny eyes, itchy sneezing, if you take one like Zyrtec, Claritin, whatever it is that you take as your allergy medicine, Benadryl, it's going to work for a short period of time, but it does nothing to heal anything. So that's like another option that could be offered. And then maybe you'll need to go to an allergist and see what are the allergies that are triggering all this. And they'll tell you these are the allergies. Maybe it's a dust mite allergy. So then you could make some changes to the environment. So important. Like maybe put in covers, if that's the case, for on the mattress for dust mites, super common allergy. Maybe you'll take away the foods that your child might be severely allergic to. But then you have to ask yourself, what caused this to be the problem in the first place? It's not normal for kids to be allergic to foods. It's not normal. It's a symptom of a bigger problem. And it's not normal for there to be seasonal allergies. I see it a lot less in South Florida, a lot less. But it's a problem everywhere in most developed countries. And it's not normal for a child to be sneezing or yourself when there's pollen or dogs or cats or trees, that's not a normal thing. That's an over-inflamed system, and that's a symptom of a bigger problem. And so addressing that is so important for long-term outcomes in kids.
Yeah. So let's say hypothetically adenoids are inflamed. We do what was the nasal spray called again?
The one I like, XLEAR. There's
Excellent.
a kid's one.
Oh, okay. Let's say do that and noticing a change. But then as soon as you stop, things return. How do you manage it with that anti-inflammatory medication or thing for temporarily?
So,
and then add in nutritional stuff?
Well, it depends. I mean, really, it varies.
Yeah.
what we're trying to do is restore the building blocks of health. So maybe you'll make some nutritional changes like for all your kids that probably benefit. If the goal, if you restore a healthy microbiome with probiotics that are beneficial in both the gut and in the ear, nose, and throat system, that would be helpful. So it's approaching it from different, like the inside out approach and the outside in approach. And in general, lowering the inflammatory bucket for your child is always going to be helpful. And what that means is making sure that when they need to detox properly, what they're exposed to naturally, and then there's a process of detox that happen, they need to be able to poop properly. So always thinking about that, optimizing gut health, and then it's like the most root cause, making sure that their nutrients are in order. Do they need to be on vitamin D supplement or zinc? These are so easy to test. These are so simple to check for. Filling in those macro and micronutrient gaps is important.
Yeah.
I can't say that it's going to be like absolute miraculous recovery forever with a mouth breathing if we add some key supplements, but it's going to lower the overall inflammatory burden and most importantly, create more resiliency in your child's system. So if there is a trigger, maybe it's an environmental trigger of some sort, they're exposed to something that they're sensitive to, or if they have a cold, they'll be able to recover quickly. Yeah. So really what we're doing is trying to create more resiliency in a child's body. There's also a field that I think is just not thought about a lot, and it's dentists, pediatric dentists that specialize in airway health. So I would, because then they're able to assess, is there a palate issue? That's a specific type of dentistry field in pediatrics. These are airway trained dentists that can assess if it would be helpful to anatomically change how the tongue is held in the mouth that could be obstructing the airway. So it's like two different paths and both are important. And I do agree that starting with ENT to get the right diagnosis is very important. Is like the best first step.
Yeah. Good. Interesting. We're going to be diving into that, like personally, soon. You mentioned asthma as well. And then with like kids, running, exercising, and exercise-induced asthma. Is that what you're describing?
Oh, actually, no, yes, in a way, that's not as concerning to me as the kids who are, they might not be diagnosed with asthma. They might have, like it's called reactive airway. It's baby asthma. So to get a diagnosis of asthma, you just have to have enough of these episodes happen. The kids that every time they get a cold, they need to use nebulizers with albuterol or albuterol inhalers. The kids that not like one time but multiple times needed to be on oral or intramuscular or IV steroids to calm the inflammation emergently in their lungs. The kids that need to be on medications like Singular or just to prevent the need for albuterol all the time. The kids that need to be on inhaled inhalers that have steroids in them chronically, that population. So they might not officially be diagnosed with asthma, but it's essentially the same thing, just waiting for that diagnosis on paper.
Interesting.
Exercise induced, I know that we're in the realm right now of physical therapy, sports medicine, athletes. I would actually say that it's not as concerning to me when I see a child who's very athletic and then they need their inhaler for, yes, it does fall into the same category. And I do think that there is optimization that needs to happen, but I wouldn't be as concerned as if it's like colds or environment that are, or we just don't know, that are triggering them all the time. And they're also, it depends on location. Like I see a lot more mold related issues here in South Florida than I do in the tri-state. So it's environmental as well.
Yeah, interesting. The mold, it makes sense because here it's so hot, humid and stuff. And I've heard that a lot too, like just harboring mold, and it's not extremely detectable like in the walls or like visually.
Right.
But what happens with that? Like we inhale it, it gets just harbored in our olfactory system.
Great question.
Yeah, what happens with that?
I think sometimes I can't sleep at night trying to because I think about this so much. What happens with it?
I think about so much.
Yeah. Sometimes I wake up in the middle of the night confused about it because it's not, mold is everywhere. It's not that, yes, there could be a household with a ton of dangerous mold, but mold is also in grains. Like when I check a lot of my patients for mold with a simple urine test all the time. If that's the concern, it's something we can check for. If there is an accumulation of mold and mold toxins in the body. But it's, I, as the physician that likes to think about root cause, it's not like why, it's not about exposure as it is about why is your child reacting
so
to it.
sensitive to it.
Yeah. Yes, of course, if there's like an absolute terrible mold growing in the household, most people will react. But usually that's not the case. Some kids are very sensitive to it. And that could masquerade as so many medical problems in kids that are chronic. That's why I can't sleep at night sometimes thinking about it, because we just don't know a lot about it. And even in functional and integrative medicine, there's so many contrasting viewpoints about it. How aggressive in adult medicine, you can get really aggressive with the ways that we detox and chelate and treat environmental exposures, if it's mold or heavy metals. In pediatrics, these are not always the approaches that we need to be taking in a 2, 3, 4-year-old. IV chelation. So how aggressive do we want to be pulling these things out of the system? But also, yes, we treat it, right? But then how do we prevent this problem from happening again over and over and over again when they go to school, and schools have a lot of mold typically? So that's the real key, is why are they not resilient enough to be able to combat it appropriately? Why are they not detoxing it properly? Is there something about their detox pathways that we really need to optimize once we're done with the acute remediation in their system of these toxins and these molds?
Yeah, good question.
Yeah.
I mean, it's similar. I mean, if a lot of kids are at school, and then there's some kids that are harboring it or have behavioral issues and allergies and all that stuff, and then other kids don't. It's okay, it makes sense. The lens of they're all exposed to the same environmental factors. Why are these kids not processing it well or filtering it well enough, managing it well in their own, resilient enough to manage it in their own body, and then manifesting as these issues? And
it really usually leads back, for me, I would say that there's I wouldn't be, I think I could say confidently that most of my patients, there is a significant improvement, maybe an 80% improvement if we optimize gut health.
Interesting.
In resiliency of the whole body, not needing as many antibiotics, not being so reactive to mold, not needing, not getting all these ear infections over and over again every time they get sick, not having digestive issues all the time. Whatever the problem is, that's why I lean so much on that, because there's just so much improvement.
I mean, it makes total sense.
Every system of the body relies on gut health to work properly. And this is where I see the biggest breakdown in kids that were born in the past 15 years.
Yeah, totally. I mean, we're constantly we're eating all the time. So what we're consuming is always entering our body, and then we're going to react to that.
Even better than that, everything in the environment, we're swallowing. So the things that we're breathing, we're swallowing. And the gut is actually is outside our body. It's a tube.
Oh, yes. Yeah.
Right?
Yeah, so totally. Yeah.
That's the inside and outside, the difference between the inside and the outside of the body and the gut is just one cell.
Interesting.
Right under that one cell are capillaries that absorb the nutrients.
All of that. Yeah, totally. Nutrients or toxins.
Exactly.
And then if we're constantly in a state of inflammatory battle,
yes,
then our system's not going to function well. And then it gets expressed as diseases or issues.
So
interesting.
Parents who are out there are is this my child? Here are a few things to think about. Is this your child? Do they need to be on medications for more than 3 months? Do they have a ton of specialists that they go to? How much school did they miss this year from illness or going to their doctor's visits? Do they look sickly to you? Do they have bags under their eyes? Are they always tired? Do they have behavioral issues? Are they complaining of belly pain? Are they constipated? Do they have seasonal allergies, environmental allergies? Do they have food allergies? Do they have eczema that is like ongoing? All of those to me are symptoms of a chronic inflammatory issue.
Interesting. Yeah. That makes total sense. Wow. But also good that like there's actionable steps, practical actionable steps that can be taken to take action on this, and actually improve functionality.
Yeah.
Versus I don't know, like something surgery or just constant medications and stuff, which sucks. That's crazy. It's good though that we can figure this, like that we can take action.
Absolutely. And the action, the small changes will make a big difference. If they're the right ones. Sometimes it's just starting to look in that direction. You don't have to change everything all at once as a family. You don't have to go and throw everything out of your fridge.
Yeah.
It's more about adding things in, really. There's a book that I love. It's by somebody that I consider to be a mentor, because she was Dr. Elisa Song, who is one of the first few pediatricians to speak on gut health and its importance.
Dr. Elisa who?
Song, S-O-N-G. And her book, I feel like it should be a must read for every parent. It's called Healthy Kids, Happy Kids.
Healthy Kids, Happy Kids.
Yes. And it's a must read. It's for parents.
Love that.
She's one of the few providers. She doesn't see patients in person anymore. She's out in California. She's one of the very, very few providers that are advocating for optimizing gut health in a way that is livable and doable and accessible to everyone. So I really recommend that book.
We're gonna get it. I'm gonna order it. We're doing it totally. Well, thanks. Well, let's land the plane here,
Okay.
but and we'll have to get you in again because we talk about a lot of stuff.
I would love to.
Well, how can people reach out to you? How can they find you?
Easy. My website is the easiest way to get all the contact information for my practices. It's blossompediatrics.com.
blossompediatrics.com. Simple. Awesome. And if y'all have any questions, comments, concerns, don't hesitate to reach out, and we'll catch y'all next time.